Hello, my name is Jasmine Zuniga, and the topic I chose is triclosan. So let's get started. So I will be talking about triclosan and its hazard identification, dose response assessment, exposure assessment, and lastly, risk characterization. So what is it? It is an antibacterial and antifungal agent, first used in the 1970s as a hospital scrub, used in consumer products like soap, dental care, cosmetics, deodorants, first aid, kitchenware, and many more. So for hazard identification, we are asking what are the health effects this agent can cause. Triclosan is considered a biocide, which is a poisonous substance that is a pesticide, and that obviously makes you not want to use a product that contains a pesticide. This chemical is able to carry the same characteristics that hormones carry, and it can replicate the way that estrogen hormone and the thyroid hormone interact. The effects is low but present. Although the Mayo Clinic does raise as much concern as others prove that it is far worse effective, like in beyond pesticides. There are also concerns about triclosan and its link with dioxin, which is highly carcinogenic and can cause health problems as severe as weakening of the immune system, decreased fertility, miscarriage, birth defects, and cancer. So some of the possible effects when contacting triclosan are altering hormones regulation in animals, interfering muscle function, increasing chance of developing allergies, asthma, and eczema, problems with thyroid hormone metabolism, possible problems with the immune system. It is also very important to know that these are possible effects, not definite effects. The effects may seem serious, but I guess the way to describe why there are so many possible effects is the same reason why when taking a new prescription drug, they list many possible side effects just for precautionary reasons. So the regulations are they are regulated both by EPA and FDA. EPA regulates pesticide use, FDA protects pesticide use. For EPA in 2008, they released registration decision for the agent. In 2010, EPA published a petition ban to hazardous agent for non-medical use. Next, for dose response assessment, we are asking what is the relationship between dose and occurrence of health effects in humans. If you brush your teeth or maybe even wear makeup, then you have more than likely have came across triclosan. You can contact the agent through your skin and mouth in small doses, but although can cause resistance from antibacterial products eventually, meaning that antibacterial products can have no effect on you. The small amounts that you can contact through your skin can lead to dermatitis or increase in allergic reactions, especially in children. So the routes of exposure are you can contact this through ingestion of toothpaste or mouthwash, contaminated food, or drinking water. According to the Minnesota Department of Health report on toxicological summary for triclosan, there is effects in endocrine, immune toxicity, development, reproductive, and neurotoxicity. The report shows that dose-related decreases in serum levels of a variety of hormones have been reported. In terms of estrogen, the agent doesn't seem to show effect, but when in contact with another agent, when co-administered with ethinyl estradiol, triclosan proteinated the estrogenic response. Using a range of ET doses, the authors demonstrated that at lower ET doses, high doses of triclosan were needed to cause potentiation. The lowest dose of ET tested was within the range of doses women on contraceptives or hormone therapy may be exposed to. However, potentiation at the ET dose required triclosan human equivalent doses that were less than 70 times higher than the short-term subchronic and chronic RFDs. So routes of exposure through metabolism. It crosses cell membranes easily. Once inside, it poisons an enzyme needed for survival. The enzyme ENR can be blocked and prevent fatty acids from producing. Another dose response assessment found in the same report would be in the allergens but tested in animals. The report states, however, when dermally administered in conjunction with an injected allergen, triclosan produced enhanced airway hyperactivity. However, this indicator of asthma in laboratory animals is inconsistent with the epidemiology studies that found no association between triclosan and asthma in humans. Correlation is non-existent with animals and humans, but risk is still detectable. Next, I will talk about exposure assessment and what exposures are currently experienced or anticipated under different conditions. Since it can be also found in the skin, there has been studies that have found that agent in breast milk. In food and chemical toxicology, it is said that the lymphophilicity and a relative stability of triclosan in the human body suggests it is likely to be present in breast milk at concentrations related to the maternal blood level and to the fat content of the milk. After collecting samples of breast milk from the mother milk banks in different locations, they found no triclosan was detected in 2 samples. It was barely detectable in 9, and the concentration ranged from about 100 to 2,100 grams per kilogram lipid in the other 51 milk samples. Although the results were not high, there was a presence, and that can be from many circumstances, like in using cleaning products. Mothers who had high concentration probably use these products since they can also be found in the skin. In the food and chemical toxicology, it is said that the lipophilicity and the relative stability of triclosan in the human body suggests it is likely to be present in breast milk and concentrations related to the maternal blood level and to the fat content of the milk. This is a concern mostly for the babies who are drinking the breast milk, who can later have health effects like in the endocrine system. Overall, although the risk is not massive, it is still present. I have also included a picture that shows that 97% people had samples of the breast milk containing triclosan. It was also found in urine for people over the age of 6. This also shows how it is found on rivers, stream, tap water, and most in liquid hand soaps. Lastly, I will be talking about risk characterization and what is the estimated occurrence of the adverse effect in a given population. The adverse effects on a given population are not as high, but are present especially in many ways it affects on public health. Traces of this agent are found in the body systems but very weakly in affecting the endocrine system, developmental and productive toxicity, chronic toxicity, and carcinogenicity. Since the agent can be found in personal care products and pharmaceuticals, it is often found down our drains after using it since it is properly used and ends up being found in, in wastewater in the US, UK, and other countries. According to the Human Health Risk Assessment of Triclosan and Lanapide Biosolids and Hazard Risk Assessment, surveys conducted by the U.S. Environmental Protection Agency and the Canadian Council of Ministers of the Environment found triclosan in 92.4% and 97% of collected sewage sludge samples. Municipal wastewater sludge can be applied to the agricultural land to increase nutrient and organic matter. One way or another, triclosan then gets introduced into the agriculture system, adding to the many ways this agent can contract you. Although, according to the Environmental Protection Agency, this can contaminate the soil, but can be harmless because, based on available data, triclosan is expected to be immobile in soil, and is not expected to volatilize from the soil, moist or dry, or water surfaces. So that is it for my presentation. I hope you have learned some new facts about your common antibacterial agent. Lastly, here are my references. Thank you very much.